My name is Kai Shane. I'm from Minnesota State University, Mankato. I'd like to thank MATA for selecting my project for this year's symposium. Unfortunately, we can't do it face to face, but hopefully this is somewhat informative and interesting. So my topic was early submaximal exercise as treatment for sports-related concussions when we compare it to the current standard of care. So as athletic trainers, we know that rest until asymptomatic and then our progression of return to play protocol is our current standard of care for patients with concussions. Um, but recent research has evaluated the efficacy of early submaximal, and when I say submaximal, I also mean subsymptom threshold aerobic exercise to facilitate reduction of symptoms and hasten return to play. So the prevailing theory behind this early submaximal exercise is based on the idea that the submaximal exercise is beneficial for return of the autonomic nervous system regulation and cerebral blood flow, which we know are impaired after a concussion and can be the cause of some of the symptoms our patients experience. So my PICO question population is athletes with sports-related concussions. Intervention, early submaximal or subsymptom threshold aerobic exercise. Traditional rest and current standard of care is what we're comparing it to. And the outcome is a reduction of symptoms and recovery time. So we did a literature search using PubMed, CINAHL, and Sports Discus. Inclusion, anything within the past 5 years. Had to include athletes and sports-related concussions, no concussions caused by other things. And time from injury to return to play had to be the outcome. So we found 5 studies. We have a cohort study, a randomized control trial, 2 quasi-experimental trials, and a retrospective study. You can see the Pedro scales here. Some of them are a little low, but that is due to the lack of blinding in these studies that can be done. In all 5 studies, we found that early submaximal aerobic exercise was associated or shown to have a significant effect in hastening reduction of symptoms and return to play when compared to rest or the current standard of care. If you look, 3 of the 5 studies use the Buffalo concussion treadmill test as their measurement for subsymptom threshold. This treadmill test has been researched and shown to be valid and reliable, as well as safe for patients with concussions. So essentially it is a treadmill test that finds the symptom threshold, and once you find that threshold, you can exercise below it to not exacerbate symptoms. And as you progress, you keep ramping up the intensity before you hit that threshold and eventually return to play. So all 5 studies, as I mentioned, used days from injury to recovery as their outcome. All 5 studies also used a daily symptom questionnaire to evaluate concussion symptoms throughout the recovery process. The cohort study and retrospective study are obviously not as strong as the experimental trials, but they did have pretty large patient populations, 2,400 and 253. So pretty good data with the patient populations. For conclusions, we found that the submaximal aerobic exercise was shown to be effective treatment in hastening reduction of symptoms and time to recovery in athletes diagnosed with a sports-related concussion. As I mentioned, the Buffalo concussion treadmill test protocol was the most common method of prescribing the subthreshold exercise. The majority of the research that I found was done on adolescent athletes, so it should be noted that more research should be done on older populations and older athlete populations. In addition, further randomly controlled trials should be done with blinding of subjects in order to better understand the efficacy of the early submaximal aerobic exercise. And during my search, I found a lot of similar research done on patients with persistent post-concussion syndrome or symptoms. And it was shown that this early submaximal aerobic exercise reduces the risk of developing that syndrome or reducing the time or symptoms with patients already diagnosed with persistent post-concussion syndrome or symptoms. So the clinical bottom line for athletic trainers, once more research is conducted and an effective protocol is established, early submaximal aerobic exercise should be considered as treatment for patients with sports-related concussions. That's all I got. Thank you to Mata again for choosing my presentation. Hopefully it was informative, and I look forward to any feedback or questions. Thanks again.